You hear a neurologist talking to a patient called Mr. Harris. For questions 1 to 12, complete the notes with a word or short phrase. Write your answers as you listen. You now have 30 seconds to look at the notes. You will hear a beep before the audio starts. This is official listening sample test of OET by Dr. Nasir.
So, Mr. Harris, I've read through the referral letter, but I'd like to hear your own version. Could you tell me how this all began? What symptoms you've noticed and what treatment you've had so far?
Well, doctor, it all started about 2 months ago. At first, I didn't think much of it. I had a strange spell where my right hand suddenly went weak and I couldn't grip the kettle properly. It lasted maybe 3 minutes, then everything went back to normal. I brushed it off as tiredness. But then the same thing happened again, a week later, except that time my speech slurred. My wife thought I'd been drinking even though I don't really touch alcohol. That cleared after half an hour or so. Since then, these attacks have become more frequent,
How often would you say they occur now?
at least 4 or 5 times a week, and they're getting harder to ignore. I sometimes drop things at work, and it's embarrassing. I'm a part-time delivery driver, and last month I almost stalled the van because my right leg felt heavy on the pedal. That frightened me enough to take sick leave. I've been off work for 3 weeks now.
Do you get any other symptoms when these episodes happen?
Yes. I often feel a thumping headache, usually behind my left eye. Sometimes it's just a dull ache, but on bad days it's like a pounding that makes me feel sick and sensitive to light. I've also had blurred vision when reading in the evening, and there are moments when I feel dizzy, like the room is spinning. Once, climbing the stairs, I nearly collapsed. I didn't lose consciousness completely, but I had to sit down before I could move again.
That does sound concerning. Have you experienced anything similar in the past?
Well, I've had migraines since my 20s, usually during exam periods at university, but they were never this frequent or disabling. 6 years ago, I was diagnosed with high blood pressure and was started on tablets. But I'll admit I haven't been very consistent with them this past year because I felt fine. My father actually had a stroke when he was 62, so that's been at the back of my mind. I've never had seizures, though, nothing like epilepsy.
Have you undergone any investigations recently?
Yes, my GP arranged some blood tests, which he said showed raised cholesterol. I was supposed to be referred for a brain scan, but the appointment hasn't come through yet. About a decade ago, I had an MRI for headaches, which was normal at the time. And 2 years ago, I had shingles, but that cleared without any issues.
What about your lifestyle?
I used to smoke about 10 cigarettes a day, but I quit 5 years ago. I can't say my diet is very balanced, though. I often skip breakfast, then grab fast food between deliveries. I drink too much coffee, at least 6 mugs a day, sometimes more when I'm driving long routes. I don't really exercise much apart from short walks with the dog. My wife keeps telling me I should cut down on salt and processed food, but I find it hard to change.
And what medication are you taking at the moment?
Only paracetamol for the headaches, though it doesn't do much. I occasionally take over-the-counter sleeping tablets because I get anxious at night and wake up sweating. I should be taking my blood pressure tablets regularly, but I admit I often forget. I don't use anything else.
Thank you, Mr. Harris. That background is very helpful. We'll arrange further tests, including brain imaging and some vascular studies. Then we'll decide on the best course of action.
Listening Part A, questions 13 to 24. You hear an orthopedic consultant talking to a patient called Mrs. Patel. For questions 13 to 24, complete the notes with a word or short phrase. Write your answers as you listen. You now have 30 seconds to look at the notes. This is official listening sample test of OET by Dr. Nasir. You will hear a beep before the audio starts.
So, Mrs. Patel, I've reviewed the notes from your GP, but I'd like to hear the story in your own words. Could you tell me how this started? What symptoms you've been experiencing, and what treatment you've had so far?
Of course. Well, I first noticed the pain in my left shoulder about 8 months ago. It wasn't too bad at the beginning. It only happened when I reached up to put things on the top shelf in the kitchen. I thought I might have just strained it carrying shopping bags. But gradually it's become much worse. Now even simple things, like fastening my clothes or brushing my hair, are painful.
So the pain has been getting progressively worse?
Yes, that's right. And it's not just the pain. The movement in that shoulder has become really restricted. I can't lift my arm fully anymore. Sometimes at night, the pain wakes me up, and I have to lie on my right side to get any rest.
Can you describe the nature of the pain?
It's a deep, aching pain most of the time. Occasionally, it feels like it's burning, especially if I try to push through the stiffness. On a bad day, I'd say it's about 8 or even 9 out of 10. It's frustrating, and I've been in tears a few times when I couldn't even get dressed properly.
What have you tried so far in terms of treatment?
Well, the GP started me on some anti-inflammatory tablets. They did help a bit at first, but I began getting stomach cramps, so I stopped them. Then I had some physiotherapy sessions. I did about 5 in total. They showed me some stretching exercises, which I tried to keep up at home. I also had one cortisone injection about 3 months ago. That gave me relief for a couple of weeks, but the pain came back just as strong.
Have you ever had any injury to the shoulder before?
No serious injury. I mean, I used to play badminton regularly in my 30s, but I never had major problems then. About 10 years ago, I slipped on wet stairs and landed awkwardly on my arm. It was sore for a while, but I didn't have an X-ray and it eventually settled. This is different, much more persistent.
Any relevant medical history otherwise?
I've been treated for type 2 diabetes for the past 7 years. I'm on tablets for that. My GP said diabetes can sometimes affect the joints, but I'm not sure if that's linked. Apart from that, I get the occasional migraine.
And your family? Any similar problems?
Well, my mother had osteoporosis in her 70s and broke her hip. She also developed quite bad arthritis in her hands. My father passed away from a heart attack, so nothing joint-related there. My younger brother, though, has recently been diagnosed with gout.
And what about your occupation or daily activities?
I've been a primary school teacher for over 25 years, so I've spent a lot of time writing on boards, marking, and lifting piles of books. It's possible all that repetitive movement hasn't helped. Now I'm finding even cooking and housework difficult. I had to ask my daughter to help with shopping, because carrying heavy bags is almost impossible.
Thank you, Mrs. Patel. That's very detailed and extremely helpful. We'll organize some imaging and further assessment, then discuss the best management options going forward.
You hear a doctor talking to a nurse about a patient who is due to have a blood transfusion. Listen and choose the answer, A, B, or C, which you think fits best according to what you hear. Complete the answer as you listen. You now have 10 seconds to read the question. You will hear a beep before the audio starts. This is official listening sample test of OET by Dr. Nasir.
Doctor, about Mr. Lawson. His transfusion is scheduled for this afternoon. The blood hasn't arrived yet.
Not again. Did the lab say why?
They mentioned the sample needed recross matching. Apparently, the initial group screen was borderline, so they didn't want to risk releasing units.
I see. So, safety issue rather than courier delay.
Yes, though he's upset. He was told he'd be finished by lunchtime.
Understandable, but I'd rather a delay than a reaction. Can you reassure him and also chase the lab? If they confirm compatibility, we can still go ahead later today.
Will do. Should I prepare fluids in the meantime?
Good idea. Let's also check his vitals before we start anything and explain to the family that accuracy takes priority here.
Instruction.
You hear a hospital manager briefing staff about a new dementia training program. Listen and choose the answer, A, B, or C, which you think fits best according to what you hear. Complete the answer as you listen. You now have 10 seconds to read the question. You will hear a beep before the audio starts.
Thank you all for coming at short notice. As you know, we're introducing a new dementia awareness program across the hospital starting next month. The reason is straightforward, and we've had several incidents recently where patients with memory loss or confusion were left unsupported, which raised complaints. We want to prevent this happening again, and the sessions will run twice a week. For the next 2 months, they'll cover how to communicate more effectively with patients showing signs of cognitive decline, strategies for de-escalating agitation, and the basics of safeguarding. Clinical staff, healthcare assistants, and even reception teams are expected to attend because anyone might encounter these patients. The expectation is that every department releases staff to attend. I've already spoken with heads of service to coordinate rotas for those worried about workload. The training has been designed to be short, focused, and directly relevant to day-to-day tasks. Overall, the goal here is to raise our collective confidence when dealing with dementia patients, regardless of role.
Listening Part B, Question 27. You hear two doctors discussing the discharge arrangements for a patient following surgery. Listen and choose the answer, A, B, or C, which you think fits best according to what you hear. Complete the answer as you listen. You now have 20 seconds to read the question. You will hear a beep before the audio starts.
So, about Mrs. Edwards. The surgeon is happy for her to go home tomorrow, but only if certain supports are in place.
Right? What's outstanding?
She still needs a home assessment. The physio said she can manage short distances with a frame, but her stairs could be an issue.
And her daughter? She mentioned she works shifts.
Yes, she can't guarantee being there during the day. That's why community nursing input is essential. I've put in a referral, but I'm not sure it's been confirmed yet.
Then let's make sure that's chased today. The last thing we want is a readmission. Also, can we double-check her medication list before discharge?
Good point. I'll ask the pharmacist to review it.
You hear a senior nurse giving a safety briefing to staff at the start of their shift. Listen and choose the answer, A, B, or C, which you think fits best according to what you hear. Complete the answer as you listen. You now have 20 seconds to read the question. You will hear a beep before the audio starts.
Right, let's go through the main issues for today. Mr. Bennett in side room 3 has tested positive for flu A, so isolation procedures are in place. Please remember to use protective equipment before entering. Mrs. Clark, who's recovering from a hip replacement, has been very restless. She was trying to get out of bed unassisted last night, so make sure her alarm is switched on when she's alone. Now, the most urgent matter is Mr. White in Bay 5. He's developed a pressure sore on his lower back, and the tissue looks fragile. He must be repositioned within the next hour and kept on a turning schedule throughout the shift. We'll need to document everything carefully for the wound team review later today. Other than that, check charts as usual and sign the safety sheet before starting.
Question 29. Instruction. You hear an oncology consultant speaking to colleagues in a multidisciplinary team meeting about a patient. Listen and choose the answer, A, B, or C, which you think fits best according to what you hear. Complete the answer as you listen. You now have 20 seconds to read the question. You will hear a beep before the audio starts.
Thanks, everyone. I'd like to discuss Mrs. Taylor, recently diagnosed with advanced ovarian cancer. We've offered her chemotherapy, but she's made it clear she doesn't want to proceed. She's well aware of the prognosis and says she values quality of life over length. I've explained that while treatment might buy her some time, the side effects could be considerable, and she feels she'd rather avoid that. Now, I don't want us to pressure her. It's important we respect her decision. That said, we must ensure she has full support. Palliative care referral has already been made, but we should also consider psychological input, as she seemed quite low in clinic. Her family are divided. Her son wants her to try treatment. Her daughter supports her choice. I'll continue discussions, but for now, our plan is clear. Manage symptoms, keep communication open, and coordinate community services.
You hear a physiotherapist reviewing progress with a patient recovering from hip replacement surgery. Listen and choose the answer, A, B, or C, which you think fits best according to what you hear. Complete the answer as you listen. You now have 20 seconds to read the question. You will hear a beep before the audio starts.
Physiotherapist. Good morning, Mr. Harris. How are you managing the exercises we agreed on last week?
Honestly, not very well. Some of them feel far too complicated when I try them at home. The diagrams help a little, but when I'm tired, I just can't follow the sequence properly.
Which ones in particular?
The side leg raises and the step practice. I either lose track or feel I'm not doing them correctly. I've been tempted just to stick to walking around the garden instead.
I understand, but the structured exercises are important for rebuilding strength. If they're too tricky, we can simplify them until you gain confidence. Walking alone won't be enough at this stage.
That would help. I don't want to give up. I just need something I can manage consistently.
Good. We'll adjust the plan today and set some achievable targets.
Listening Part C, Extract 1. You hear a public health specialist, Dr. Emily Carter, giving a presentation to medical trainees about the impact of sleep deprivation on healthcare workers. Listen and choose the answer, A, B, or C, which you think fits best according to what you hear. Complete the answers as you listen. You now have 90 seconds to read questions 31 to 36. You will hear a beep before the audio starts. This is official listening sample test of OET by Dr. Nasir.
Good afternoon, everyone. Today, I'd like to talk about a topic that has become increasingly relevant in healthcare: the effects of sleep deprivation on doctors, nurses, and other clinical staff. We often think of tiredness as just a personal inconvenience, but in medicine, fatigue has wider implications, not only for the individual, but also for patient safety. Now, one reason this problem is underestimated is that many professionals believe they can push through tiredness. Culturally, medicine has often celebrated those who stay late or work long stretches without rest, as if endurance were a badge of honor. The reality is rather different. Research shows that cognitive performance after being awake for 20 hours is similar to having a blood alcohol level over the legal driving limit. Yet, paradoxically, many doctors would never drive after drinking, but think nothing of treating patients after a night without sleep. I'll give you an example from one of my colleagues, a surgical registrar. He described leaving the operating theater after a long shift, realizing he had almost no memory of the final hour of procedures. He hadn't made an obvious error, but he was alarmed by how impaired he must have been without realizing it. This illustrates a key issue. Sleep deprivation dulls self-awareness, so staff often underestimate just how affected they are. Another important factor is the long-term health risks. Chronic sleep restriction has been linked with hypertension, metabolic disorders, and even higher rates of depression and anxiety. Among junior doctors, we're seeing rising levels of burnout, and fatigue is a major contributor. One trainee I interviewed said that she reached a point where she would cry in the changing rooms before night shifts, not because of the patients, but because she was so utterly exhausted. Now, some argue that doctors have always worked long hours, so this is nothing new. But I'd suggest that modern healthcare is far more complex than in the past. Electronic records, constant monitoring, high patient expectations, all demand continuous attention. When you combine this with exhaustion, errors are more likely. Studies from the US have shown a clear correlation between staff fatigue and medication errors, even serious adverse events. So, what can we do about it? One approach is rostering reforms, limiting shift length, ensuring minimum rest periods, and discouraging the culture of unpaid overtime. These changes are unpopular with some senior staff who claim it disrupts continuity of care. But the evidence suggests that well-rested clinicians actually provide safer, more consistent care overall. Another strategy is education, teaching staff to recognize the signs of fatigue in themselves and colleagues is vital. Simple steps like strategic napping, proper hydration, and avoiding excessive caffeine late in shifts can help. Of course, these are not cures, they're mitigations. The real solution lies in systemic change, not individual willpower. Finally, I think it's important to shift attitudes. Being awake for 24 hours should not be seen as heroic. It should be seen as unsafe. We've made that cultural shift in relation to drunk driving. Perhaps we now need to do the same for extreme fatigue in medicine. Thank you.
Listening Part C, Extract 2. You hear Dr. Michael Green, a consultant in infectious diseases, being interviewed about antimicrobial resistance and its impact on healthcare. Listen and choose the answer, A, B, or C, which you think fits best according to what you hear. Complete the answers as you listen. You now have 90 seconds to read questions 37 to 42. You will hear a beep before the audio starts. This is official listening sample test of OET by Dr. Nasir.
Dr. Green, antimicrobial resistance is often in the news these days. Why has it become such a pressing issue?
Well, antibiotics are one of the greatest achievements of modern medicine, but their effectiveness is diminishing. The problem isn't new. Alexander Fleming actually warned about it when penicillin was first mass-produced. But what's changed is the scale. We're seeing more and more bacteria that no longer respond to the drugs we rely on. And this isn't some abstract future scenario. It's happening now, in intensive care units, surgical wards, even community clinics.
Some people might think this mainly affects very ill patients.
That's a common misconception. Resistant infections can affect anyone, young or old, healthy or frail. For example, we've had cases of routine urinary tract infections in otherwise fit young women where first-line antibiotics failed. Imagine the impact of that on everyday practice. Another example I often give is elective surgery, joint replacements, cesarean sections, cancer chemotherapy. All these procedures depend on effective antibiotics to prevent infection. If those drugs stop working, the risks of such treatments rise sharply. So antimicrobial resistance is not just an infectious disease problem, it threatens the whole foundation of modern healthcare.
Why is resistance rising so quickly?
There are several reasons. Overuse of antibiotics is a major driver, not only in hospitals, but also in community prescribing and, importantly, agriculture. In many parts of the world, antibiotics can be bought over the counter without prescription, which accelerates misuse. But it's not just overuse, it's also inappropriate use, like prescribing antibiotics for viral infections where they have no benefit.
What about new drugs? Aren't pharmaceutical companies developing alternatives?
Unfortunately, the pipeline is thin. Developing antibiotics isn't commercially attractive compared to drugs for chronic conditions, so very few new classes have come on the market in the last 30 years. That's why stewardship, making the best use of what we already have, is critical.
Can you explain what stewardship involves?
Certainly. At its heart, it's about prescribing antibiotics only when necessary, and using the right drug at the right dose for the right duration. It also means educating patients, so they understand why they may not need antibiotics for things like a cough or cold. Hospitals are increasingly using rapid diagnostic tests to help guide treatment, and multidisciplinary teams, pharmacists, microbiologists, infection control nurses, are all part of this.
Some might say this is all very well in high-income countries, but what about resource-limited settings?
That's a real challenge. In many low-income regions, basic infection control is difficult. Access to clean water, hand hygiene facilities, and reliable laboratory services is limited. If we can't even confirm what organism is causing an infection, rational prescribing becomes much harder. International cooperation is vital here because resistance doesn't respect borders. A resistant strain emerging in one country can be on the other side of the world within days.
So, what should clinicians take away from all this?
Two things, really. First, that antimicrobial resistance is not someone else's problem. It affects all of us across specialties and patient groups. Second, that we all have a role to play. Whether it's double-checking before prescribing, explaining to a patient why antibiotics won't help their viral illness, or supporting infection control policies in the workplace, every small action adds up. And perhaps most importantly, we need to change the narrative. Using antibiotics responsibly should not be seen as denying patients treatment. It should be seen as protecting the ability to treat infections effectively in the future. Much like climate change, it's about sustainability.